Our next group of exercise is stretching of the hip flexors, and we'll go from a gentle stretch to a more vigorous stretch as we go through our exercise progression. Our first stretch for the hip flexors is a single knee to chest stretch, so we'll have AJ bring this knee up to the chest, and we're stretching the hip flexors on the left. So I'd like him to bring this leg to neutral, bring the kneecap towards the ceiling, and really try and push the leg down into the table. And the patient should be feeling that through the anterior hip region in the region of the hip flexors. And we can have them hold this position for 30 seconds. Again, this would be a beginning hip flexor stretch. We can progress that up to a kneeling position. And for this stretch, the critical component is that the patient controls the lumbopelvic region and doesn't go into an anterior tilt, because we know that the hip flexors originate off the lumbar spine and ASIS. In setting this up, I'd like the bottom leg to be vertical and even slightly internally rotated to lengthen iliopsoas. I'll typically have the patient back out of that position, bringing their whole body back, and then going into a posterior pelvic tilt, tightening the glutes and the abdominals. And then they're going to translate their belly button forward, bringing the pelvis forward to stretch the hip flexors on this left leg. And they should feel that through the anterior hip and even possibly down through rectus femoris for this kneeling hip flexor stretch. You want to make sure that they don't lose that posterior pelvic tilt. So I'm going to have you back out of that a little bit and really keep those glutes on, glutes tight, and don't lose that and come forward. And you feel the stretch there? Mm-hmm. So we lost our pelvic tilt, and now we have glutes on, which is going to help stabilize the lumbopelvic region for this kneeling hip flexor stretch. And again, we want to have them hold for approximately a minimum of 30 seconds with this stretch. From this position, we can go down to a modified Thomas test position. The patient's going to sit on the edge of the bed, pull one knee to the chest, and then lay back. Often, when they start the stretch, the weight of this leg will make it difficult to pull the opposite knee to the chest. So you can have them flex this hip and really snug up the top leg, and then slowly lower this leg to get the stretch in the hip flexors on the left leg. And we want to make sure that they maintain this knee, the opposite leg, snug to the chest. And this position is the modified Thomas test position to lengthen the hip flexors. We can add knee flexion to get a little more rectus femoris stretch in this modified Thomas test position. Our final position will be in side lying. And what we do in this position is we recreate that modified Thomas test position by having him flex the bottom leg. He's going to hold that with the ipsilateral hand, and then with his other hand he's going to flex the knee, and then he's going to add hip extension. By having this hip flexed, it maintains the lumbopelvic position, and then we can get hip extension to lengthen the hip flexors as well as rectus femoris. We want to make sure that the thigh stays parallel to the table so that we can get some lengthening of TFL. And this is the side lying modified Thomas test or hip flexor stretch. Thank you.